Well, good morning and welcome to another edition of the Miami-Dade Economic Advocacy Trust Business in the Black. This morning I'm really pleased. I'm actually speaking to a young man who has really elevated himself in our community. It's rare that you get natives of Miami that have decided to take the great skill sets that they have and stay home and contribute to our community. So this morning I'm meeting with the president and CEO of the Jessie Trice Community Health System. And he had to remind me that it's system because Bill Diggs has been here long enough to remember when it was a center. But Ryan, man, good morning. Welcome.
Morning. Thank you for having me. I'm honored to be here and kind of share a little bit about Jessie Trice Community Health System and what we're doing in the community. So thank you for having me.
Well, listen, man, first of all, thank you, brother. Listen, I'm proud of you. I can't tell you, um, you know, those of us that have been in Miami for quite some time, we've always talked about the disposition of talent and how some of the best and brightest leave this community. And and you try not to say, wait a minute, don't go. And they leave in search of a better opportunity.
Yeah.
Well, luckily enough, my good friend Sherwood DuBose and the rest of the leadership of Jessie Trice, along with our dear friend Dr. Annie Neesman, was smart enough to find a way to recruit one of the rising stars of Jackson's public health system. Man, tell me about yourself, brother. Let's go back to mom and pop, where you're from, elementary school. Tell us kind of how you got here. Tell me about your journey.
So I'm a native of Miami. My mom and dad are native Miami, Miami Northwestern and Booker T. Washington graduates. So middle class upbringing. Lived in El Portal most of my life, but spent the majority of it in Liberty City. One grandmother was in off of 50th Street by Hadley Park, and the other one was in the projects in Miami-Dade County. So that was my formal upbringing. Grew up in the community, taught to prioritize giving back to the community. That was something that was instilled in me at an early age.
So where did you go to high school at?
I went to high school at Coral Park. Miami Central is my home school, but I'm a proud Coral Park Ram. I wanted to be an engineer.
Okay.
That was the engineering magnet.
Oh, there's a magnet school. Yeah,
definitely.
Good.
I did find out, though, that calculus is not my thing. And so,
Not mine either.
Yeah, and I have a passion for helping people. So as I matriculated to Florida A&M University, I really
You're a rattler.
I'm a rattler. And really focused on social work and trying to be able to work with individuals to help them be the best that they could be. And then as I went to Florida State for grad school, I got a master's in social work.
Oh.
But I really wanted to focus on the macro level, and that really focused on policy.
Yeah.
I had the honor of doing a dual master's at Florida State in public administration. And luckily for me, I had a class, Government in the Sunshine, that was taught by former Governor Ruben Askew.
Now that's special.
Yeah, it really was. Got to be able to understand how politics really helps to shape how our communities are built and move forward and grow. And so from there, I ended up, after I graduated with my master's, working for Senator Larcenia Bullard in South Dade, and I did some government work there. And then I worked for Commissioner Barbara Jordan in Miami-Dade County.
Yeah.
And working for Commissioner Jordan, I had a portfolio that included healthcare, small business, community action agency, and a lot of those other social services.
You know, Barbara Jordan is iconic to me. Okay. And I say that out of respect. It's funny because you mentioned two giants, man. You know, Larcenia Bullard, who is she has raised one of the brightest young men that I know. Yeah. And I smile because he's funny and he's highly intellectually smart. And then I look at Barbara Jordan, who really shaped policy, not only from being an administrator at the county, but then being a county leader and on the board of county commissioners. So to know that you've gotten the tutelage of both of them, that's interesting.
Yeah, and I think her experience as an administrator really helped her as an elected official, because she could see the pros and cons of both sides and understand what it actually took to implement appropriate policy that will effectuate change.
Yeah.
So I'm very thankful to be able to work for her. And actually, her birthday is tomorrow, so
Wow.
I'll make sure I reach out to her. But from working with her, I ended up meeting Carlos Magoya, who's the president and CEO of Jackson Health System.
Right.
And through that relationship and working with them, the opportunity to work in healthcare presented itself. And I went to work at Jackson, and I worked there and moved through various positions over the 8 years until I finished at Jackson North. And Jackson North was a special facility for me because it's where my family receives their care. One of the places. And it's also near the school that bears the name of my mother in Miami Gardens, Barbara Hawkins Elementary.
Now I didn't know that.
Oh, okay.
I did not know that. I thought I knew a lot about you, brother. I didn't know that.
Yeah. My mom was a principal for many years.
Yes, she was.
Until her untimely death. And, the students and the faculty and the administration in the Miami-Dade County Public Schools thought it appropriate to rename that facility in her honor.
They did.
She
exactly.
was the principal of the year. Wow, that was 1998. Principal of the year for Miami-Dade County, and I think she was runner-up for principal of the year for the state of Florida that year. So Miami-Dade County is my home, and having the ability to work at Jackson North, where we were undergoing a huge revitalization of the facility.
Sure.
Construction-wise, new technology, and it was very important for me to be in charge of that because this is my community.
Right.
And I felt that individuals shouldn't have to go to an Aventura or a Memorial or even downtown to be able to get quality health care in a beautiful environment. And so I made it a point to make sure that I did everything I needed to do to make sure that facility was in tip-top shape. And when I left, we finished over $150 million renovation to the facility.
That's a lot.
Yeah, prioritizing all areas that touch patient care. Because you got to have a good experience. Healthcare isn't just about the quality of care that you receive. It's also about the environment that you receive it in. And so I wanted to make sure that was of high standards for my community. So
you're right about that because it's funny. I mean, as you know, I went through some knee surgery, and I realized it's great when the doctors do it right. But it's beautiful when you know that your rehabilitation or while you're there convalescing, that you get the appropriate, not just level of care, man, but the folk that come and see you, that the look and feel of the place and all that stuff really lines up. And you're right. I think that you guys did a great job at Jackson North.
Thank you.
Okay, so listen, so let's be frank about this. Here you are, and everybody in our community knows it. And as much as you're humble, you left, man. You jumped off the rocket at Jackson, right? I mean, Ryan Hawkins, ultimately CEO of Jackson. On that trajectory in every way, as an administrator, as a social worker, as a person who's got the right pedigree from this environment that can speak, with kings and queens, not be too wise, don't talk too much. Here you are, and you say you're going to answer the call at Jessie Trice. What was that about?
It was a calling to the community. This is the neighborhood health center that my grandmother would go to. My grandfather would travel to. And a funny story, my very first day on board at Jessie Trice, Mrs. Clinch, who was my former executive assistant, she had been there for 40 plus years.
At
Jessie Trice.
Wow.
I worked with Ms. Trice.
Wow.
And she told me, she said, "You don't remember me, do you?" I said, "I'm sorry, I don't." My mom was on the board at Jessie Trice. So I would accompany her to board meetings as a child. And as a 6, 7-year-old, you're just running around. You're not paying attention. But going places with my mom, going places with my dad, being involved in the community, it felt like I was back home. I was where I needed to be because the skills that I had developed and the connections that I have made through Jackson and through working in county government, this is what we needed at Jessie Trice at this period in time
Sure.
to be able to meet the needs of our community coming straight out of COVID, to be able to look at our processes and make them better, not just for us as an organization, but how do we get back out into the community? One of the things that concerns me at Jessie Trice, and even when I was at Jackson, at Jackson North, too many people focus on going to the emergency room as their main point of access of care.
Yeah, we were talking about that earlier, right?
And cost-wise, to an individual, it's 5, 6, 7 times more expensive to go to the emergency department than it is to prioritize your health and go to your primary care facility.
Right.
And also, when you go to the emergency department, they're really going to only focus on that acute issue that you present with, i.e., you go with a broken toe.
Sure.
They're going to patch you up, they're going to put it in a cast and tell you to follow up with your primary care. And too often than not, most of people in our community, they don't. And regardless of race, color, creed, people have busy lives and they don't take the time to prioritize their health. So my main purpose at Jessie Trice is to make it easier to access health care, even if we need to bring it to you, so that you don't end up utilizing the emergency room, increasing your overall cost, increasing the cost or burden on the taxpayers to be able to cover that, but also to manage your health. We see chronic disease management as far as dealing with cardiovascular disease and diabetes. These are things, if managed appropriately, you can have a long-lasting life with minimizing the overall effects. So go see your primary care provider. And if you don't have one, we can find one for you. And I think the beauty or the synergy of it with Jessie Trice and Jackson was that we're both safety net hospital or safety net primary care system. So regardless of your ability to pay, we're going to see you. Now, there may be a sliding fee scale of $20, $25 for a visit, but I'm not going to stop you from coming to see your provider. So we really focus on getting you in the door, giving you the tools that you need to prioritize your health and be as healthy as possible.
Now, so tell me about the facilities, brother. I mean, because you got 8, 9 of them now. How many do you have?
So we have 9 facilities with a new pediatric facility currently under design with the architects. We're looking to open up in the Ponciana area in in Miami within the next 2 years.
That's huge.
Yeah, very excited.
Pediatric.
Pediatric. We're talking medical. We're talking dental. We're talking behavioral health. A facility designed for children.
Oh man, that is great.
Yeah, and it's amazing having the conversations about the slight nuances of lowering the door handle 1 foot lower so that the small child feels important and engaged, that they can turn the door without having to overstretch to reach. It's amazing, the little things that make a difference in their care. We also have a 40-bed inpatient substance abuse women program, and we're also in 60 schools. So
like clinics?
Yeah, so basically
60?
Yeah, 60 with the Children's Trust. Back in the day when I was in school, there was always a school nurse, right? You don't have that in most schools, but we are the school nurses now. So with our partnership with the Children's Trust.
I didn't know it was 60.
Yeah.
That's a lot.
It's a lot.
I mean, okay, so these 9 centers, give me a geographic idea. Where are they located at?
So original location starting in Liberty City off of 54th and 22nd, but we go from City of Miami, Liberty City over to Hialeah, all the way up to Miami Gardens. And we go as far east as North Shore Hospital, where we have our pediatric and family practice center there.
How many employees do you guys have?
We have over 350 employees, and we prioritize as far as doing business with local and minority-owned businesses. So we really prioritize keeping our dollars as much as possible within the community of South Florida.
All right, so this is the rub. So this is what's interesting, right? This is where Ryan Hawkins has got to be a sound administrator, because you got to make payroll.
Yeah. Gotta make payroll.
Yeah, yeah,
I like to tell people we're not a free clinic, right?
right.
We're a federally qualified health center that was born out of President Lyndon Johnson's war on poverty. So we take all insurance. We work with a multitude of insurance and payers. Um, and so we're not a free clinic, but we won't turn you away for service.
So can you share kind of what the percentages look like? Pay, insurance, gap in between the two. Give me an idea, man, in regards to kind of what you
Yeah.
look like.
So in that reference, we're probably only around about 18 to 20% of individuals who are uninsured.
Okay.
We have a large population of Medicaid enrollees,
Mhm.
probably around about 40 something percent. The remainder is broken up between your Medicare, managed Medicare, and of course, your big insurance providers, your Aetnas, your AvMeds, your Blue Cross Blue Shield.
Yeah,
Yeah.
yeah. So you offer the same level of care that a regular hospital would.
Essentially, and I'm glad you put it that way
Uh-huh.
because we want to be your comprehensive primary medical care home. So we have adults and peds, we have OBGYN services, we have podiatric service, podiatrists, we have dental clinics, we have the behavioral health therapists, we have laboratory services, we have our own pharmacy as well. So we are a one-stop shop where you can
Mhm.
receive all that you need to manage your care.
Okay, how can we help, right? I mean, what I mean we, the community that's insured,
Mhm.
that lives in Miami-Dade County. What's the value set and proposition for us? Why would we come to your clinic?
As I said before, one-stop shop, but
Right.
also you're benefiting yourself. You're making sure you're prioritizing your overall care.
Mhm.
And a lot of individuals who have insurance, they don't
Mhm.
take the time to prioritize it and go to see their
Right.
providers. So the number one ask would be, if you don't have a medical home, come see us.
Yeah.
We'll be your medical home, even if it's just to get an annual checkup.
So here's what's interesting. One of the biggest problems in Miami-Dade, and some of it is based on the cost of living. One of the major issues has been the recruitment of people of color in the medical field to come here as doctors and
Mhm.
physicians and apply their trade, right? So, you either need to come as an intern or as a resident. And it's hard, but the social construct really does reign supreme. And what I mean by that is I took my father to a doctor at Augusta, Georgia. He's a military veteran, and it was a white doctor. And he said, "Hey, Joe, how you feel?" Talking to my father. My father was in his 90s. This man was in his 70s. They knew each other. Joe said, "I'm okay. I'm good." He said, "Okay, great." So he, took his vitals, took his blood, shook his hand. The reason I was in town is because my father wasn't feeling well.
Mhm.
And so then he had an appointment that afternoon with his heart doctor. And he said, "Hey, Joe, how you feel?" Black doctor.
Yeah.
Joe said, "I'm good. I'm feeling pretty good." He said, "What's that mean?"
Yeah.
And I realized that he heard him from a cultural perspective that he was like, when you ask me, am I good?
Mhm.
Mentally, I'm good,
Yeah.
right? I'm a black man. I'm surviving.
Yep.
I'm making it. But physically, my response denotes something different when we have a cultural feel with each other. And I think that that's the one thing that I will say that I love about Jessie Trice and what you're building, because you are understanding the cultural concepts of how healthcare must be personal.
Definitely.
So talk about that for a little bit, if you
So
would.
we really emphasize on cultural sensitivity for all staff, but especially our providers, and making
Mhm.
sure that they understand the population, whether you're African American or Hispanic, that you're working with,
Mhm.
so that you can have these conversations and feel
Yeah,
comfortable with the
yeah,
individuals and understand them.
yeah.
But also to your point previously about the recruitment efforts, it's tough everywhere. And post COVID, there's a lot of individuals that have left the healthcare field, a lot of
Mhm.
physicians, a lot of nurses that just decided this isn't for me anymore after
Wow.
that. And so it's tough to be able to um, recruit and retain quality individuals. So we're super excited. We have a dental and a medical family practice residency program We have we have 5 dental residents, and we just kicked off our inaugural family practice residency
Oh, wow.
with 4 individuals. And with our hope is that these individuals, once they spend time within these communities of
Yeah.
underserved individuals, that they find the passion within to be able to continue their careers. Because a lot of times individuals that start off and they complete residency in the hospital, they stay in that hospital world.
Mm.
So working in a qualified health center or comprehensive family practice, you get that experience, and with the hopes that you stay within these communities to be able to build your practice and build the relationships. I've been going to the same medical provider probably since for almost 20 plus years. And
Yeah,
so
me too, man.
and so when you build that kind of relationship with the individual and they understand you, like you said with your father, I'm doing good. But what does that really mean? And I have that personal relationship with you. So I know I need to dig a little bit deeper
There you go.
with you at this point.
There you go.
Really get to the root of the matter.
Yeah, that makes a big difference.
Yeah.
So you guys are in your headquarter building. That building is relatively new as well, though, isn't it?
Yeah, so our headquarters off of 56 and 27, that's probably around about 10 years old right now. Our newest facility that opened up, the Barbara Jordan Health and Wellness Center in Miami Gardens across from the stadium, is just 7 years old now.
That's right. That's right. Yeah, good. So now, is that a full service practice out of that facility?
Yes, that has family practice, that has pediatrics, it has OB-GYN, it has a pharmacy, it has a lab, and it has a dental component. And what we also are very proud of, we have a multi-purpose room that when it was developed with the desire from the board to have a quality meeting space where the community can rent to be able to hold appropriate functions. So if you want to have a business meeting, or if you want to host students from a school to be able to share nutritional information with them, that we're available for that. And so we have a lot of organizations that take advantage of that.
Gotcha. So Mike, tell me, man, what's the average day look like for you as an administrator at Jessie Trice?
Well, I usually start off every day looking at our Epic system. I want to see how many of our patients are scheduled for that day. We look for opportunities if there's a lot of vacancies within a certain provider's schedule. Make sure we start reaching out to individuals to get them in to see if we can go ahead and fill up that schedule.
Yeah.
I'm a hands-on person, so I like to pop up at different locations.
Yeah.
Not just to like surprise people, but I want individuals to know that I'm in this with you as well.
Sure.
So I'll pop up at Fatima Zafar, our main clinic off of 54th Street. I talk to our patients. I like to make sure that they know who I am, and I like to ask them, how's your experience been, right? How do you feel about your provider? Are you getting the kind of care that you want? And, my people, they're open and honest, and sometimes you got to be careful about what you ask for.
Yeah.
Yep.
Yeah.
But I'm appreciative of it because
Sure.
it kind of sets me on the right path to who I need to speak with, and what changes we need to make.
Sure.
There's a multitude of meetings and business and strategic initiatives that we need to follow up on. Tons of emails, but it's fulfilling, and I love it.
Yeah, because first of all, you wake up with this, you go to sleep with it, and then somehow you got to figure out, are you really doing good, right?
Yeah.
So how do you measure your success? And this is two questions. One, how do you measure the success of Ryan Hawkins, and how do you measure the success of Jessie Trice?
I measure the success of Jessie Trice. I look at our financial numbers. Are we able to meet payroll? Are we able to retain all of our services? With a lot of things that are happening now, you have some facilities that are closing, they're downsizing. Luckily, we've not had to do any of that as of yet, so we keep the doors open because they're critical access points for the community.
Yeah.
How do I gauge success for Ryan Hawkins? Healthier community. I look at our quality metrics, diabetes management, the appropriate screenings for individuals. We've seen significant increases in those numbers because we're engaging individuals when we come in, right? Hey, it's time for your mammogram. Okay, ma'am, I know you don't want to do it this time, but we're going to give you the referral. And we follow up with individuals because
Sure.
what I've learned is that we have a lot of individuals who are hourly wage workers, right? And meaning that they're not going to take off work to come to a doctor's office to sit around for 2-3 hours.
Yeah. That's
So
respect. You're right. And mind you, you know this. I mean, that's what we see a lot of times.
yeah. So we really try to focus on how can we shorten that time.
Mhm.
If you're supposed to be there for 9 o'clock, 9:15 at the latest, you should be in with your provider. Now, there may be instances where
Yeah, sure.
kind of overrun, but we want to try to respect your time.
Yeah.
But we've also established late evening hours as well. So
Oh,
once you get off at 5 o'clock, now you can come and see either your OB-GYN or family practice provider. And we also deploy telehealth as well.
okay.
To
Oh, that's a neat new world.
yeah, it is. And COVID really highlighted that for a lot of us.
Yeah,
So
yeah.
we're excited to do that. So seeing the improvement in the quality metrics means that the community is getting healthier.
Okay.
Seeing more individuals post-pandemic come back into the facilities, we've seen probably about an increase of 2,000 to 2,500 new patients within the last year, and also increased visits. So people are coming back and they're taking the cue to prioritize their health. And so we want to make sure that we're there for them to do that.
We got like 3.5 minutes left. I want to ask you this, and this is important. Jessie Trice, Annie Neesman, Ryan Hawkins.
Yeah.
What's the growth? Where do you want to go? Where do you see you and your very electric board of leaders that helps you to kind of guide the policy of this organization? Where are you going?
We're going to continue to grow our footprint because there's still large pockets within Miami-Dade County of individuals that they don't have access to care. We have a new center that's opening up in Liberty Square. And I told an individual, my grandmother in the Liberty Square project, she stayed maybe 3 blocks away from where this new location was.
Right.
And as a child, I would walk with her to her doctor's appointments. I would go see Dr. Brown, her ophthalmologist, and we would walk over there. And I remember my mom, my dad would say, you keep a peppermint in your pocket, right? Because if her blood sugar goes low, then she has something to be able to, and I know the signs, right, to kind of make sure I give her the help. So we want to grow our footprint. We have a lot of aged facilities. Right. And so we're doing a large capital campaign. Our main center, Team of Zafar.
Okay, good.
We're raising funds to be able to redevelop that because 60-plus-year-old facility.
Right.
The people that come there to receive services, they deserve a quality facility, and that's my aim to give them that.
Gotcha.
Also want to make sure that we are partnering with the hospitals as well, because there's a lot of individuals that when they leave those emergency rooms, they don't go to the primary care. So I would love to have it when you are discharged from either a Jackson or a Mount Sinai, Hialeah hospital, that you have an appointment at the nearest Jessie Trice location within 3 days to follow up.
Gotcha.
And if you don't follow up, we follow up with you. And so access to care, if I could just say it in one term, is really the most important thing for us.
Okay. All right. So minute left. You mentioned the big word, capital campaign.
Oh, yeah.
How much and by when? What's your goal?
My goal is $25 million to be able to redevelop Fatima Zafar, and we're looking to do that within the next 5 years. So
there it is, $25 million.
Yes.
So how do we get in touch with you? How do people contribute to this opportunity?
You can give us a call at Jessie Trice, 305-637-6400. Ask to speak to Ryan Hawkins or Fabian Thurston or Tony Thompson.
Good.
And we'll make sure that we get you the right package. Or you can go through our foundation, the Jessie Trice Foundation. So, and all of that information is on jtchs.org.
jtch.org.
JTCHS.
jtchs.org.
Yes, sir.
Okay. Listen, I can't thank you enough, man. I mean, I'm so impressed with you. I'm so proud that they had the vision because, first of all, big shoes to fill. Annie Neesman is an icon,
Oh, yeah.
but they got the right man for the job. And I don't know how they pulled it off, but I think that some of it is destined, because when you talk about your wonderful mother and your family, I understand,
Yeah.
why, a young dynamic brother like yourself would pull up in this train and decide to be a big, big part of the growth for Jessie Trice. So
Yeah.
Ryan Hawkins, Jessie Trice Community Health System.
Yes.
I appreciate you today, man. Thank you for coming by.
Thank you.
We're going to have you again. We're going to follow up on your capital campaign, see if we can help you raise this money.
I thank you a lot. We're a part of the city and the heart of the city, and we'll continue to be there.
All right. Thank you.
All right.